Hello, this is Dr. Syed Arshad Hussain. I'm a consultant pulmonologist. I'm also adjunct professor in pulmonary medicine, and we have talked about the common topic of cough, and we talked about various causes: acute, subacute, and chronic cough. So depending on the causes of the cough, the treatment has to be worked out. Again, if a chest x-ray is normal, then as I said, the commonest cause of a cough is allergy in the airways or asthma. And for that, you would need inhaler treatment, which is usually long-acting beta agonist and inhaled corticosteroid. Along with the inhaler, we would need some leukotriene inhibitors, which are also bronchodilator therapy, which acts on a different pathway to be available. And the third thing is to add some anticholinergic agent. We have done a recent study with my researchers, and in that we found that sometimes three modalities of bronchodilator therapy becomes the most important modality in controlling cough. Sometimes with one, sometimes with two, sometimes even three treatment modalities are required to control the cough. Now, if the cough is because of an allergic rhinitis, you obviously need a spray with the inhaled corticosteroid in there as well. And if it's a gastroesophageal reflux disease, you need a tablet, which is a PPI, a proton pump inhibitor, to prevent the acid reflux causing the problem. The other causes we've touched on will be shown up on an X-ray or a CT scan, including pneumonias or TB or maybe bronchiectasis. So depending on that, the treatment will vary. And if it's a lung cancer, then depending on the staging of that lung cancer, a treatment is decided. A lot of time people use honey, lemon, and various other modalities, including some cough syrup and mixtures. Sometimes there is no evidence base behind that, but if it suits somebody, then they usually try to use these modalities. But certainly in the environment in GCC countries, where the dust in the atmosphere is very high, the inhalers have a very, very positive role in a persisting cough condition. Thank you.